He has practiced internal medicine and nephrology since 1977 and is currently a faculty member at the University of Virginia Medical School. He's representing the American College of Physicians, where he serves as president. The American College of Physicians is the largest medical specialty organization and the second largest physician group in the United States. Welcome.
Thank you, Chairwoman Velasquez and Ranking Member Graves, for allowing me to share the American College of Physicians' views regarding the President's health care budget for fiscal year 2010. As mentioned, I'm Jeff Harris, President of the ACP. Until recently, I practiced in a rural community with a population of 40,000. The office in which I practiced focused on the delivery of primary care and nephrology. I have practiced internal medicine for nearly 30 years. This year, I have the good fortune of being president of the American College of Physicians, representing 126,000 internal medicine physicians and medical students. The ACP is the largest physician specialty organization in the United States. Smaller physician practices are an essential part of the system of care in the U.S. Congress has a historic opportunity to adopt a budget that will help physicians and small practices provide the best possible care to patients by, one, eliminating payment cuts from the sustainable growth rate, known as SGR, and accounting for the true cost associated with providing updates that keep pace with the practice of medicine and its cost. Secondly, increasing Medicare payments to primary care physicians to make them competitive with other specialties and career choices. And thirdly, funding programs to support and expand the patient-centered medical home. Over the past several years, one of the college's main priorities has been urging Congress to reform the SGR, Medicare's flawed physician payment formula. This formula has led to scheduled annual cuts in physician payments for each of the past 7 years. This coming January, as Joe mentioned, physicians face a 21% Medicare payment decrease unless Congress intervenes to avert the cut. Since this is a hearing of the Committee on Small Business, the following analogy may help illustrate the problem. Imagine you work for a small business and imagine that your boss told you that your wages would be cut by 10% this year. Later, your boss announces that your company will not cut your wages, but that the only way the company can afford to stop the 10% cut would be to pretend to reduce your wages by 20% the following year. You're told not to worry, though. They'll just do the same thing the next year. Prevent the 20% cut by pretending that the costs will be cut of your wages by 40% the following year. You're told, though, that the company has no intention of ever allowing a 40% cut to happen. They just have to pretend they will do so the accountants will allow them to stop the immediate pay cut. And on it would go. No small business would actually run its payroll budget this way. Yet this is how Washington has handled costs associated with stopping the SGR, up until now, that is. President Obama's budget is a marked departure from past practices because it acknowledges what we all know to be true, which is that preventing pay cuts to doctors will require that the Medicare baseline spending be increased accordingly. Once the true costs are accounted for in the budget, Congress and the administration would enact a long-term solution that will permanently eliminate the SGR as a factor in updating payments for physician services. Instead, payment updates should provide predictable increases based on the cost to practice of providing care to Medicare patients. This is especially important for physicians in smaller practices. Also, the primary care shortage is escalating at a time when the need for primary care physicians is greater than ever. Our aging population further increases the demand for general internists and family physicians. Congress should enact Medicare payment reform so that the career choices of medical students and young physicians are largely unaffected by considerations of differences in earnings potentials. Currently, primary care physicians on average earn 55% of what non-primary care specialists earn on average. Is it a wonder then why only 2% of fourth-year medical students plan to go into general internal medicine, one of the two specialties that adults depend upon for their primary care? The college believes that a reasonable goal would be to raise primary compensation to the 80th percentile of the compensation of other specialties. This would require that Medicare and other payers increase primary care reimbursement by 7 to 8% per year over the next 5 years. Such an investment in primary care will result in better health and lower cost of care. To illustrate, a recent study in the American Journal of Medicine found that a higher ratio of primary care physicians in areas was associated with fewer hospital admissions, emergency department visits, and surgeries. Congress should allow for some of the aggregate savings from reduced utilizations associated with primary care to be used to fund payment increases for primary care. The patient-centered medical home enjoys the support of a wide range of health care stakeholders. Policymakers view it as a promising reform model, with Congress authorizing the Medicare Medical Home Demonstration Project through a 2006 law and supplementing it with a dedicated funding and increased ability for expansion through a 2008 law. The current Medicare Medical Home Demonstration, which is limited to 8 states, should be expanded to a national pilot with increased funding to allow for such expansion. ACP is grateful for the opportunity to share its views regarding the President's budget and looks forward to working with you to improve the quality and lower the cost of our health care system. Thank you.